Tammy, broadcasting live from the southern tip of Africa on the Nurse TV. And today we're talking to Dr. Ethel Andrews, who's done her PhD in burns and the treatment of burns. But not only that, she is now the president of the Burn Society in South Africa. And isn't that a first for a nurse to be in charge of that?
It is. It's such a huge honor for me.
Yes. Now, why did that come about?
The health industry, and burn specifically, is moving more towards a multidisciplinary approach, and more the nurses are leaning in and our role is recognized. Whereas historically we were left behind doing the work without the necessary acknowledgement, but now we are seen as equal multidisciplinary contributors, and we can now lean in and be part of the whole team.
So it is obviously the nurse who does all the dressings in the ward situation and the unit situation. Tell me about the treatment of burns nowadays. What is the latest technology for burns?
Burns it's ever advancing. Before, and I'm sure maybe you are familiar, we used to use the white cream on our patients. The doctor would prescribe it and it would be a daily dressing.
Yes.
Now we know that we shouldn't be doing dressings every single day, so we're moving more to once in 3 day dressings, because then you're maintaining the heat of the wound and you're also then reducing the risk of infection on the wound itself. So the latest technology, if it is a partial thickness burn for instance, would be a skin substitute, and then we would use solvents that can stay on for 3 to 7 days, even 10 days in some instances.
Okay. You say that the treatment has changed to once every 3 days because it reduces the infection rate. What happens if somebody's in the township, in a location where there is very little resources? What would a person do then if there was a burn from either boiling water or fire?
Initially, you would want to cool down the burn as quickly as possible. So if there is running water, 20 minutes cold running water, and get the person to the hospital as quickly as possible. The reason why we say this is that professionals can then do the assessment, because some patients do need to be admitted, even if it's just for pain control.
Yes.
And then we can get the fluid resuscitation started so that we can then minimize the effect, because remember that the burn is not just about the damage to the skin. It has a knock-on effect on every single system in the body.
Okay. I didn't know that. I don't know much about burns myself. So water is the first line of treatment for 20 minutes.
Yeah.
After that, what do they do to get the person to the hospital? How would they know that it's bad enough to take a person to the hospital?
If you've got cling wrap at your home, cover the patient with, so remove the clothes, because it's pointless you're keeping the person running there for 20 minutes and then you cool down the patient as opposed to just cooling down the burn, because what we're wanting to do is maintain a normal temperature for the patient, but we want to cool down the burn. So if the burn is on the top part of it, like a little child that threw water on themselves, you would remove that item of clothing, get them under the cold water, and then cover them with cling wrap. If you don't have cling wrap, just a towel or any dry piece of cloth that's available, and get them to the hospital as soon as possible.
Okay, so it doesn't matter what sort of a burn, they must all go to the hospital?
Ideally, you would,
Yes.
because even if it means that it's a very small burn, because in South Africa 10% burn needs to be admitted. But we can always get to the hospital and they can tell you to go home, as
Yes.
opposed to you sitting and putting on butter and sand and cow dung, and then you then introduce new organisms and you just complicate the situation. So to get to the hospital as quickly as possible, that would be the ideal.
Okay, and then you talk about skin replacement if there are deep burns. What sort of skin replacement do they use in South Africa?
South Africa, we have got porcine, so we have got a company locally that manufactures, but we also have international product that gets imported skin substitute. So the base of it would either be porcine or bovine, so that would either
Porcine,
be
meat, pork skin, and
bovine, which is
cow
cow
skin.
skin.
And that has collagen in it to actually boost the healing
Yes.
of the wound.
So what it does is it acts as a scaffold, so that all the structures would then fall in place normally, either then while you are waiting for the skin to grow back or until you are waiting for a graft to happen. The other thing with the benefit of the skin substitute is that your nerve endings are covered, so it reduces pain. And then we know that one of the functions of the skin is to prevent heat and moisture loss. So if you put it on a skin substitute, it then acts as a skin and it then facilitates all those things. So your patient doesn't lose heat, they don't lose excessive moisture, because all of those things are in a nice protective environment.
So that particular skin, that is replacement skin, is it actually sewn on?
It's clipped on, but that would be in adults. I mean, in the interest of time, the surgeons would either normally clip it on, but in your pediatrics, they could glue it on, but some of them do so just for comfort's sake, because it's painful when you have to remove those staples.
And is that a permanent?
No.
It's not a permanent graft. So after that has to come off, and other things have to be done.
So if it is a partial thickness burn, it would heal underneath it without any other further intervention. So it would then re-epithelialize, that's when you grow back new skin, and the skin substitute would then separate itself, and underneath you would have healthy new skin. If it is just used as temporary cover while we are waiting for something else to be put on, then that has to be removed, so it just then repairs the wound bed while we are waiting.
So interesting. You made a mention earlier that if people burn themselves, in South Africa we have water, we use water. What do they use elsewhere in the world to put onto burns as an immediate treatment?
Water still, water and more water,
yes.
But in more advanced, even in South Africa, we have got a hydrocolloid dressing that is put on, but that is just in the emergency situation, because the purpose of it is to cool down the burn. If you present to the hospital after 4 hours, then it's not necessary, because by then the burn would have cooled down, because then you run the risk of encouraging hypothermia if you leave it on for too long, and then also the wound becomes macerated. So you need to do an assessment. So cooling down only for 4 hours. After that, you need to put on a proper dressing.
So it's been said that some people say put on potato peels because that will help. How would a potato peel help on a wound or a burn?
In South Africa, we don't advocate the use of potato peels. That happens in more resource-restricted countries. Higher up in Africa, for instance, that's what they would use. In India, our colleagues, they use banana leaves. But that is the same equivalent of us using our skin substitutes in South Africa. So it's just a temporary cover. People use whatever they've got available to them, just to make sure that, again, you don't lose heat, you don't lose moisture, and then also so that whatever bacteria is in and around the environment doesn't penetrate into the wound.
Okay. So there you go. If you have a burn anywhere in South Africa, the first line of treatment is water for 20 minutes or until they actually feel no pain.
20 minutes ideally, because if we don't give a time frame, people don't really know. Is it 5 minutes, 2 minutes? So if we say 20 minutes, we know that it is cooled down adequately. But 20 minutes feels very long. My son had a burn and he was crying that 20 minutes seems forever, and me standing there as the parent, I realized that 20 minutes seems excessive, but this is how much time you need, because as long as the heat source remains there, the burn goes deeper. So we're minimizing the effect by cooling down.
So what a wonderful journey you've had, and I hope you go from strength to strength.
Thank you.
Thank you for this interview.
My pleasure.
Next week we talk to Dr. Ethel Andrews about being an entrepreneur in nursing. Join us on the Nurse TV.